A new study has found that children born during the pandemic are taking longer to reach certain developmental milestones more than kids born before 2020, so before the pandemic. Joining me to discuss this study is 9 News health expert Dr. Payal Kohli. Thank you for coming in.
Good morning, Corey.
This is fascinating to me because I have 2 littles. My daughter was a pandemic baby born in September of 2020. So the study comes from the Royal College of Surgeons in Dublin, Ireland. Talk about why they decided to research this.
This is being called the COVID generation. So it's really a bunch of kids that are born during the pandemic that we expect physically, socially are going to have a whole different trajectory. And this is one of 3 studies, in fact, that just recently got published that's saying it's not just the communication skills, but even the gross motor and fine motor skills that develop that could be affected. So this is a study out of Ireland. They looked at about 300 babies that were born within 3 months of the lockdown starting and looked to see over a year how did their communication develop. And essentially at a year, compared to historical controls, babies born before, they were doing less pointing, less waving, and they were less able to say a single word.
Wow. And do you think part of that's from masks, social distancing, that kind of interaction?
Yes, we're just starting to learn kind of why it is. We think some of it, most of it we think is nurture, not nature. But we think that mom's mental state during pregnancy could have been a part of it. So, the fact that mom obviously had different circumstances when she was delivering, but then after pregnancy, of course, one of the ways that babies learn language, they learn social interaction, they learn motor skills is by emulating others, by watching others. And most of these babies spent most of their time at home just with their immediate family. The masks prevent us from seeing lips and seeing facial expressions, so some of that is part of it. And then some of it is more frazzled parents that perhaps were interacting differently with their children. Now, what's interesting is there's also data in the opposite direction, is that babies born during the pandemic actually crawled faster and longer compared to historical controls because they didn't spend as much time in car seats and they spent more time at home.
Interesting. Wow. All right, so if you're a parent, how can you determine if your kid is a little bit delayed, if they're not reaching these milestones?
This happened to a friend of mine, a colleague who's a physician, and she noticed that her son, even though it was her first pregnancy, was just not hitting those milestones. So I think frequent assessment of the milestones and doing it more often and doing it regularly to ensure that it's not just the first year, the second year, the third, the fourth, and even your adolescents and teens, I would add, are being affected in some of these ways. So just sort of checking in on your kid frequently, and then if they need to get matched up with a speech therapist or, a child psychiatrist or whatever resources you might need, talking to your doctor about that.
And I think that's so important because it is hitting different age groups. I mean, this one focused on babies, but we're touring schools right now, and one of the schools that we just toured, they said 6 of their students are being held back in preschool because they're just not hitting those milestones.
Yeah, exactly. I mean, it sounds very scary, but I will say the opposite piece of this is that especially babies and kids, their brains are so plastic. And so we really need to look at this as a glass half full situation. Just recognition is the key, because as soon as you recognize, hopefully we can turn this around with the right resources. And as I said, there may even be some added benefits to spending a lot of time with your core family and such that we haven't yet discovered.
There's time to catch up, so don't worry. Dr. Kohli, thank you for coming in.